That's awesome. So, Ashish, since you have been involved with AI and now Gen AI for some time, could you narrate any use cases that you might have been involved with yourselves or people that you know have done successfully? What are some of the things on the landscape that are making it into the health system? And what is some of the future directions that you see over there as well?
Yeah, happy to. So when we started doing research work with Valid AI, we are looking at every single publication, preprint or major journal publication that's coming for use case. So we're setting up a use case library of 165 use cases. And
Nice.
the domains we are finding are either on the employee and physician productivity. So we
Hmm.
are seeing like AI scribe is perfect in that space on physician productivity. But we're also seeing emergence of tools which will cater to all employees of the healthcare worker, not just the
Right.
clinical workforce. And we are kind of looking at those possibilities. Then we're also looking things at the patient automation side. Can we
Hmm.
bring generative AI solutions which can guide the patients wherever they are? Because we have an access problem. And it's not easy just to pick up a phone and talk to anyone in health system, but get some of the routine work be done by generative AI solutions and guide the patients automated or semi-automated with humans in the loop sometime. Then we're also seeing operational efficiency solutions like RCM and those which can allow better
Yeah.
and enhanced capture. So we're seeing kind of a three-legged kind of approach to that. And we are using a prism kind of a method from Gartner, which looks at feasibility as well as time. And we are putting a next layer is impact. So you look the lens
Yes.
from whatever is feasible today, and the time to onboard that is not much, and it creates a maximum impact that can help you prioritize the most relevant use cases. Because it's not about bringing AI, it's about solving what problem. And then you find the relevant things, AI or non AI, to
Right.
be able to do that. So part of us is also educating our executives and leaders to start with a design thinking approach or problem first approach, of a
Right.
strategy first approach. And that's something our phase two of Valid AI looks like, where we create kind of a way to align everyone around strategy and problem first approach, then the most meaningful, impactful use cases that come. And then we are able to measure the impact. So, few cases that we already have implemented. One is AI Scribe. And I was talking 2 years ago, it's going to be like water. Everyone is going to be using AI Scribe
Yes.
because, and this is the first time, Rohit, I have seen the chairmans kind of arguing with each other who should go first.
Wow.
You know,
Yeah.
technology typically has a productivity paradox when it comes to
Yes.
healthcare. Every industry has benefited with productivity except us in healthcare.
Yes.
But I do feel finally the time is here when we unlock the productivity paradox with technology for healthcare with generative AI. And AI Scribe is a perfect example of that. We implemented in pilot phase and we just got ravishing reviews, including physicians just writing that this is the best technology they have seen till date. And this is a physician who's
Awesome.
about to retire,
Right.
right? We didn't have to train them. We've also brought technologies in Vision AI, something like AI Doc, where we were able to find that more PEs can be detected at
Right.
an earlier time. So we fast
Right.
track that implementation as a platform. So we have 7 sectors in AI from a strategic lens at UC Davis
Hmm.
Health. So we've been able to bring applications from risk prediction, like sepsis algorithms built in LA, then we fine tune that, to things which can predict how the person is going to go worse based on alerts coming from wearable sensors, to vision AI, computer vision technologies, to technologies like generative AI from AI Scribe, but also then looking at and understanding generative AI. Can we unleash it to all the employees, bring the policies and other together to make every employee more powerful and impactful?